Hi, this is Dr. Stazan Sina, and in this video I'm going to talk about adolescent substance abuse, particularly those things a parent should look out for if they suspect their teen is using or abusing drugs and alcohol. Number one on our list is a decline in academic performance, that is, a sudden drop in grades, and a shift from a previous stable level of functioning. Here I'm talking about a teenager who goes from an A or B performance or a B or C performance to suddenly having a number of D's or F's. Now, not all teens who experience a drop in grades are abusing or using substances. However, it is the number one sign of substance abuse in teens. Number two, increased secrecy about possessions, activities, and whereabouts. In a previous video, I've discussed the difference between privacy and secrecy, where privacy usually implies something beneficial or at least non-harmful. Secrecy, on the other hand, often implies something else that could be brewing that, as a parent, you may want to monitor. 3. Sudden use of deodorants, sprays, or incense, things that would cover up smells or odors that a teenager would not want their parent to pick up on. So, if you dare, poke your head into your teen's room and take a good whiff and see if anything pops up. While you're in there, look around. Look for other telltale signs like a propped open window with a fan blowing toward the outside, or a rolled up towel at the base of the door to prevent smells, odors, or smoke from escaping from a teen's room. Number 4, coded language. I'll often have parents come to me and say they're hearing their teens using new terms, or they've come across some text messages with some new terms or abbreviations they're not familiar with. Well, as a parent, it's important to educate yourself about new terms, slang, and abbreviations in order to keep on top of things and to monitor for potential substance abuse or substance use. 5. New friends. New friends can be great, as I've also mentioned in a previous video. What I'm talking about here is sudden shifts in friendships, or particularly sudden shifts in whole peer groups. This is something to be more concerned about. 6. Changes in clothing that reflect the drug culture. Here I'm talking about t-shirts or baseball caps with cannabis leaves on them, the Jack Daniels or Budweiser logos, or perhaps even good old Bob Marley. 7. Increase in borrowing money. Chances are if your teen is using alcohol or drugs, they're going to need some money to buy the substances. If they already have a job and you find that their paychecks are coming in but they have nothing to show for it, and on top of that they're wanting to borrow money, this may be cause of alarm about what your teens are spending their money on. On a similar note, a parent should also be mindful of how much money they have in their wallet or purses in order to monitor for any missing funds. 8. Paraphernalia. Some paraphernalia is quite obvious. Empty beer bottles, empty beer cans, a pipe, a bong, rolling papers, and some paraphernalia is not quite as obvious. These are things that I call contraptions and are things that your teen has created in order to probably smoke out of. Hollowed out apple cores, soda cans, 2-liter bottles, or even toilet paper rolls have been known to be used to smoke from. 9. Missing household objects, items, or prescription drugs. Missing household objects that I'm talking about are whipped cream dispensers, glue, or paint, things that your teen can sniff or huff. Prescription drugs are probably going to come out of your medicine cabinet or your friend's medicine cabinets. 64% of teens who abuse prescription drugs are getting them from their parents or from their friends. So it's time to get away from the notion of a medicine cabinet for your prescription drugs and start to consider something like a locked box. 10. Eye drops. Those little Visine bottles. If you're starting to find these around your teen's car or their room, perhaps it's just a sign of allergies, or perhaps it's a sign of them covering something up, especially if you're seeing some of these other items on our list. Number 11. New use of mouthwash or mints. presumably to cover up an odor or a smell that your teen would rather not have you pick up on. When your teen goes out for the evening, you should probably wait up and greet them at the door. Give them a hug, take a good whiff of their clothing, smell their breath, look them in the eye. Try to have a coherent conversation. This is just a little mini sobriety test that you can do in your home. Lastly, if you sense that your teen is abusing or using drugs and alcohol, consider the use of home drug testing. I know a lot of parents, and especially teens, have a problem with this in that they complain of a violation of trust. However, if your teen is abusing substances, you're going to want to know about this sooner than later in order to prevent something potentially greater happening down the road. I hope this has been informative for you, and I hope that you join me for future videos. Thank you.